Hello, my name is Martha Stevens and I'm an equine vet at B&W Equine Vets over in Gloucestershire, and today we're going to talk about vaccination and infectious diseases in the UK horse population. So first of all, why should we vaccinate our horses? So vaccination provides both individual protection and herd immunity within a group of horses. Now, herd immunity is probably a word that we've all heard quite a lot recently. And essentially, it means that by vaccinating a group of horses, we can prevent spread of disease throughout that group. Now, vaccinating one horse provides some degree of individual protection for that horse, but it will also protect other horses by reducing that horse's chance of spreading disease. This then provides protection for the minority of horses which are unvaccinated or have had incorrect vaccinations. For equine influenza or equine flu, which is one of the most common vaccinations that we give as vets, the threshold percentage to achieve herd immunity is a vaccination rate of over 70%. This is particularly relevant for competition because often horses will travel, will be stressed, and will have a slightly lower immune system. So by insisting that every horse that travels to a competition is thoroughly vaccinated, competitions can ensure that they don't allow large outbreaks of disease to happen on their watch. Herd immunity doesn't apply to tetanus vaccines. Although tetanus is infectious, it's not contagious, so this means that horses can't pass it between themselves. They can only get it from something, from the ground or from tetanus that they come into contact with in the environment. Therefore, the tetanus vaccine provides individual protection, but it doesn't provide herd immunity for a group. So the first disease that we'll discuss in detail is equine influenza or equine flu. This is a highly contagious virus which causes a respiratory disease. It's considered endemic in Europe, which means that it is constantly around at a low level. So by being endemic, that means the disease is present, basically. It's always there. But we do sometimes see larger outbreaks of disease, such as the one that occurred in January and February 2019, when we had a much higher rate of equine influenza than would be considered normal. Now, outbreaks of disease tend to happen when susceptible horses are congregated and housed together in close contact with each other. So things like horse shows, sales, racetracks, and movement of horses on the same lorries, all of those things allow for horses that already have equine influenza to come into contact with unvaccinated horses, cough on them, and spread the disease around. In terms of how equine influenza is spread, so first of all, it can be direct horse-to-horse contact, so horses touching noses, horses sniffing each other, grooming each other, all that sort of thing. But it can also become airborne and spread as airborne virus particles in the environment, or via contamination of clothing, equipment, stables, horse boxes, all of those sort of things. So an infected horse will shed into their environment when they cough, and then if another horse comes into that environment, they are at risk of picking up the disease. It has a relatively short incubation period. So the incubation period is the time from being exposed to the disease to developing clinical signs. And in equine influenza, this is only a roughly 48-hour period, and horses can remain infectious for up to a week after the onset of clinical signs. So most horses will be contagious for up to about 10 days, roughly, from infection. So what symptoms should we look out for with equine influenza? The first thing that you'll often see is a raised temperature. So a normal horse's temperature should be below 38.5 degrees Celsius. So anything that goes over that is abnormal and can be seen as a horse having a fever. They'll often lose their appetite early in the disease and just be lethargic, feel a bit rubbish, basically. And then they'll often develop a snotty nose or a runny nose. They may develop a harsh cough and swollen neck glands. In general, an uncomplicated case of equine influenza in a horse with no pre-existing conditions will resolve within 1 to 2 weeks, although the cough can persist for several weeks after infection. Similar to human influenza, it can make your lungs a little bit damaged and take a little while for things to completely resolve. There are some complications of equine influenza that can occur relatively infrequently, and they can be quite severe, and this includes secondary bacterial pneumonia, so a nasty chest infection on top of the original virus, muscle soreness, and inflammation of the heart muscle and limb swelling. So it's definitely worth liaising with your vet if you suspect your horse may be showing signs of equine influenza, for both your horse's sake and the sake of any horses that it may come into contact with. So which horses should be vaccinated against influenza? Ideally all horses. So this is partly to protect themselves, but also to maintain herd immunity in the yard area that you're in and in the greater area that you ride in, and any competitions or group activities that you might do. Under the correct conditions, it's actually possible for the virus to become airborne and travel up to 5 kilometres. So it's important to consider equine influenza vaccines for horses that don't even leave the yard if you're in an area with lots of horses around you. So when we're vaccinating for equine influenza, there's a very specific vaccination protocol that we follow. So the first vaccination should occur from 6 months old, and that's because of the day naught. Under 6 months old, foals actually have protection from their maternal antibodies, particularly if the mare is already vaccinated. The second vaccination should occur 21 to 92 days after the first one, and the third is 150 to 215 days from the second, which roughly translates as 5 to 7 months from the second. These are then followed by either yearly or 6-monthly boosters, depending on the level of movement that your horse undertakes, particularly on and off the yard, and what activities your horse partakes in. So many competitions will ask for 6-monthly boosters, and it's important to find out before you're entering competitions what the requirements are so that you can make sure that you plan for this in advance. If your horse is travelling to competitions, they must have their vaccination no sooner than 7 days. So they can't have it within the last 7 days pre-competition in case they feel unwell post-vaccination. And the FBI rules state that they must have it every 6 months, plus or minus 21 days. So you've got a little bit of leeway, but again, not within 7 days of a competition. If you have any concerns about planning your vaccines or any questions about exact dates, it's definitely worth speaking to your vet, and they should be able to give you clear guidance on when your horse can be vaccinated and when it should be done before, to ensure that you're able to partake in whichever competitions you want to. So next up, we'll talk about tetanus. Now, tetanus can be quite a nasty infection, and we strongly recommend that every horse is vaccinated against it. It's caused by the bacteria Clostridium tetani, which is an anaerobic organism, which means that it doesn't need oxygen to survive, so it particularly likes sort of dark, horrible places. Clostridium tetani survives in the environment, particularly things like soil and droppings, for really long periods of time. So horses don't have to leave the yard to be at risk. Any horse in any environment is potentially at risk of tetanus infection. It tends to enter the body via wounds. So puncture wounds and foot penetrating wounds carry a very high risk because of the nice dark anaerobic or lack of oxygen conditions that they provide. And it can actually also be acquired for horses with gastric ulcers if they eat droppings or highly contaminated soil, and then it enters through the broken mucosa in the stomach. It's fairly rare, but it's certainly a potential possibility. Once Clostridium tetani has got into a contaminated wound, it multiplies rapidly and it produces a toxin, and it's this tetanus toxin that causes the fairly unpleasant clinical signs of tetanus that we often know. So the tetanus toxin affects the nervous system, and this is how we see the clinical signs of tetanus. It attacks the nerves that control the muscles of the body, and this shows in external symptoms such as a protruding third eyelid, so you can see the third eyelid more obviously than normal, extension, stiffness of the limbs, and spasm of the jaw muscles, which is often called lockjaw. It's very unpleasant actually as a disease, and although it can be treated, it is unfortunately often fatal. Horses with an early diagnosis can sometimes be treated, and this can include large doses of tetanus antitoxin or large doses of penicillin, but unfortunately often by the time that we diagnose tetanus, the toxin is already attacking many of the muscles in the body, and although we can attempt supportive care and therapy, we do unfortunately lose a number of these cases. So we strongly recommend vaccinating all horses, donkeys and equids against it. Now, the vaccination protocol starts off similar to equine influenza, so they'll have their first vaccination from 6 months of age. They'll then have a second vaccination 4 to 6 weeks later, and then a third vaccination 12 months after the second. Now, once they've had this third vaccination a year after their second jab, they actually only need a biannual booster, so they only need it every other year. Tetanus is often included as a combination vaccine with equine influenza, so the first and second vaccines will tie in together quite nicely, and this combination booster means that horses don't have to have 2 injections every other year, they can just have 1. So equine herpes virus, or EHV, is another infectious disease that we have a vaccine available for. It's a contagious viral infection that can cause abortions, respiratory disease and neurological disease, and it actually has 5 strains, but 2 of these strains are the most significant. So first of all, EHV1, which can cause abortion and neurological disease, and EHV4, which mainly causes respiratory disease. Once infected, the individual can harbour the virus for the rest of their life and then can potentially shed this disease to other horses without showing clinical signs. Reinfection and shedding from infected horses tends to happen when horses are stressed. So youngsters that are moving yards, or any horses that are moving yards, to be honest, or if they're in hard work or during pregnancy, all things that will lower a horse's immune system and lead to reinfection and shedding. Equine herpes virus is actually ubiquitous with the equine population, meaning it's extremely common, and exposure to the virus is reported to be up to 93% in some populations. This doesn't mean that every horse is going to show clinical signs of it, but it certainly is a virus that a lot of horses will be exposed to at some point in their lives. The respiratory cases of equine herpes virus will often go undiagnosed because it can cause relatively mild disease, which can be just put down to being a horse that's slightly under the weather, picked up a little bit of a virus, but without needing to diagnose exactly what's caused it. The EHV is most commonly identified when there are outbreaks of abortion or neurological problems in horses, as both of these 2 things cause much more significant loss of health to the horse and loss to, for example, a stud farm with an abortion outbreak. In January 2020, we did see an outbreak of neurological herpes at a large equestrian centre in Hampshire, and unfortunately this did lead to the euthanasia of 3 horses due to severe neurological signs. So the neurological form of the disease can be extremely debilitating and can lead to a fatal outcome, unfortunately. The symptoms of equine herpes virus vary massively. They can be very similar to equine influenza if they have the respiratory form of the disease, and this includes a high temperature, snotty or runny nose, a dry cough, lethargy, loss of appetite, swollen neck glands, and anything else that you would assume to associate with a respiratory virus. In pregnant mares, it can also lead to abortion, and this can go through a population of pregnant mares and cause what we call an abortion storm in a group of unvaccinated pregnant mares. Less commonly, horses can develop neurological symptoms, and this can initially appear as being weak and wobbly on their back legs, potentially accompanied by urinary incontinence, and it can progress to horses that are actually physically unable to use their back legs, which can be quite severe and very unpleasant. Equine herpes virus does not stimulate significant natural immunity after initial infection, so a horse can be susceptible to reinfection after just a few months of exposure. Vaccination has been proven to reduce clinical signs in affected horses and decrease the amount of virus that these horses shed, and therefore it's an important part of a comprehensive protection strategy. In terms of which horses should be vaccinated for equine herpes, there are some populations who are particularly at risk. So horses who are less than 5 years of age, particularly if they travel, if they're moving from one yard to another, or if they're going to competitions, they can certainly be increasingly at risk compared to a horse that's, say, 10 or 12. Pregnant mares and horses who are in contact with pregnant mares can be more at risk, and horses who are at a livery yard that has frequent equine movement, so big competition yards in particular, or performance horses who travel to compete, because travel is certainly a recognised risk factor for reducing their lowering of a horse's immunity, and therefore increased chance of them picking up a viral infection. Pregnant mares should also, as well as the initial course, be vaccinated at 5, 7 and 9 months of their gestation in order to adequately protect them against equine herpes virus during their pregnancy, and also to provide a degree of herd immunity within a group of pregnant mares to avoid a larger outbreak of abortion within a group. In terms of their herpes vaccination protocol, we recommend that horses will have their first vaccination from 6 months old, and then the second vaccination 4 to 6 weeks later. They should then have a booster every 6 months due to the reduced length of time horses have herpes immunity compared to other diseases. Vaccination does not provide full protection or potentially any protection against the neurological equine herpes virus, but it does reduce viral shedding, which then helps to reduce the severity of an outbreak and hopefully reduce the number of horses who are affected if you have an outbreak of herpes in your area. The last contagious disease that we're going to talk about today is Strangles. It's a very well-known disease, and I'm sure you've all heard about it before, but I just thought we'd give you a quick overview of what Strangles is and what we need to watch out for. So it's extremely contagious, and it can be quite debilitating disease that can affect any horse on any yard at any time. It's not particularly choosy about where it hits. It's a disease that's caused by a bacteria called Streptococcus equi, and this can be very easily spread directly horse to horse through nasal discharge, and also indirectly from nasal discharge landing on contaminated equipment, people's clothing and boots, etc. It can't be spread through the air, although it can be spread when a horse with strangles coughs or snorts. So although horses can certainly spray it everywhere, it's not strictly an airborne disease. The clinical signs of strangles often start with a high temperature. So again, anything over 38.5 would be considered abnormal. They can then become lethargic, dull, generally off colour and depressed, and then progress to a reluctance to eat or drink, difficulty swallowing, and sometimes a lowered head and neck position or a stretched out head and neck position. They will often then develop at some stage a thick and discoloured, so often yellow or green nasal discharge, and some horses will develop a cough, although not all of them do. Swelling of the lymph nodes or glands under the jaw is quite common as well, and also in the space between the head and neck. These swollen glands can then lead to development of abscesses which burst, and that discharges highly infectious, thick, creamy yellow pus. So in terms of infection, both the snot from the nose and the pus from any burst abscesses are excellent ways of the bacteria being transmitted around. In some cases, although relatively uncommonly, the glands will swell so much that they restrict the airway, which is how it got the name Strangles in the first place. Some horses will develop what we call atypical strangles. This is fairly uncommon, but basically it results in horses showing slightly more unusual clinical signs. So this can start as a mild fever, show different types of nasal discharge, or just a slight loss of appetite, or even no signs at all. Horses with atypical strangles may go unnoticed, but they can still shed the infection to others. So if your horse is showing mild signs, it's always sensible to isolate them as a precaution and contact your vet for advice. It usually takes 3 to 14 days after the horse has been in contact with the Strangles bacteria for clinical signs to develop. This is called the incubation period, although this can take up to 21 days, so we would always advise to err on the side of caution and isolate a horse for 21 days if there is any suggestion that they might have been exposed to strangles. A high temperature is often the very first indicator you'll get. We often recommend, particularly in a yard strangles outbreak situation, that owners take their horse's temperature morning and evening and keep a record of any temperatures that are increasing for the vet to examine. This will often happen before the horse shows any other clinical signs of being unwell. Roughly 10% of infected horses will end up becoming Strangles carriers. Now, this is because the bacteria will sometimes hide out in the horse's guttural pouches and can then be quite difficult to clear out of this area. You often won't know that your horse is a carrier, but they can unfortunately still cause disease in other horses due to small amounts of bacteria being shed by the nasal passages. Carriers will often appear completely outwardly healthy, but they can definitely be a biosecurity problem on a yard due to their ability to infect others.
In terms of a Strangles vaccine, there is one available, but we don't currently recommend that it's used. It's a live vaccination and the immunity does not last very long. It's thought to last up to about 3 months. The vaccine's given transmucosally, which is under the lip, and unfortunately this does often result in painful swellings and reactions. So the best way to protect your horse against strangles is good hygiene and careful management of the situation and biosecurity. And this can include testing and isolation of new horses. Your vet will always be very happy to give you advice on biosecurity and isolation, as well as the best way of testing horses. And this can include blood tests and potentially guttural pouch washes, depending on the situation and the clinical signs that your horse is showing. We always advise speaking to a vet for the best way to test the horse depending on the situation.
The Horse Health Programme is a competitively priced preventative healthcare plan which saves you money and spreads the cost throughout the year in equal monthly payments. It provides you with everything you need to help keep your horse fit and healthy, and one of its many benefits include an annual flu and tetanus booster vaccination. The Horse Health Programme is only available from CVS equine veterinary practices. To find a practice near you, go to www.horsehealthprogramme.co.uk.